In February 2009, the International Expert Meeting on Health Significance of Fat Quality of the Diet took place in Barcelona. 40 world-class experts in nutrition and health from over 25 countries representing all continents came together with the aim to help people to make healthier choices with respect to their fat intake.
Pleased to introduce to you Dr. Ricardo Wow.
Thank you. Well, first of all, welcome. You come from many places. We hope this will be an... I think that the interesting part is here we're not only talking to ourselves. Here we're talking to the users of the information, and hopefully all of us will have the public in mind as we define what is the best approach, just so that we're not saying on the one hand this, on the other hand, that gets confusing to the public. So we're trying to streamline our messages and do that in conjunction with people that have done consumer surveys, the people that do the communications, and such as yourself that are linked to the dissemination of information.
Consumers sometimes do not follow the information come from the academics, simply because it is put in words and in a form, in a language the consumer cannot understand.
Consumer research shows that people are confused about the role of fat in a healthy, balanced diet. 60% of the studied people do not think that fat is part of a healthy, balanced diet. 65% think that a low-fat diet is a healthy diet, and about 40% claim to avoid foods containing fats. So people are unaware that fat should be part of a healthy diet, and that the majority of this fat should be good and essential fats. Essential fats are the ones our body needs but cannot make by itself, so we have to eat them. These misunderstandings are reflected in the fact that the current intake of good and essential fat of many people is not in line with recommendations. This has potential consequences for the health and well-being of children and adults worldwide, as essential fats are vital to our cell growth, heart and blood vessels.
As the science gets more complicated and scientific understanding grows, that inevitably makes it harder for the average person in the street to actually understand some of the messages that they're getting. So as the science develops, which is great, and you know we're pushing forward with all the science, which is really good, it gets increasingly difficult, I think, for consumers to keep up with it and to really understand, you know, all these different things that they're being told, the fact that these things are moving forward, so the messages tend to change.
People are really very confused about this fat story, and there's so much discussion about obesity, and so people think they should avoid all fat. And I think, first of all, we from medical profession, we should give a simple message that there are good fats and bad fats, and then communicate that to the people, and of course work accordingly so that it would be easier for people really to switch from saturated fats to unsaturated fats.
When you talk essential fats, people do understand, of course, what essential means. You need it. But then when you move into, you know, well, there's a certain amount of fats and certain kind of fats, you just see the glaze over. So therefore, what I've moved to as a dietitian is my message is we need fat to be healthy. There are certain kinds of fat that make sure that we produce the hormones we need, that make sure our cell walls hold their integrity, that we're healthy. So you need fat to be healthy. And the kinds of fats you need, we understand they come from plant fats, so the oils, products made from oils, nuts, seeds, and of course, what we know about fatty fish as a part of healthy eating.
So yes, as we think about protein being crucial for muscle and strength, and calcium being strong for your bones, we need to think that those essential fats are key for how our body works.
An agreed and signed summary statement captured the outcomes of this meeting, including guidelines for an optimal fat quality of the diet. One of the best ways for consumers to improve and increase their intake of essential fats, experts said, is by replacing products with a low-fat quality, such as butter, with products with a high-fat quality, such as nuts, fatty fish, vegetable oils, and products made thereof, such as soft margarines and mayonnaise. Furthermore, the experts called upon scientists, healthcare professionals, health authorities, governments, food industry and media around the world to advocate consistent, simple and effective messages to consumers, which helps them achieve and maintain optimal health.
It starts very easy by, going to the supermarket, and when you buy, say, your milk products, your meats, just choose products with lower contents of these animal fats. And then if you use fats, spreads, or fats for cooking, just choose unsaturated fats. Look at your products. Take the vegetable oil instead of the lard for cooking. And that makes a huge difference. And it doesn't make a huge difference in taste or in whatever you do. It's just replacing one product for the other.
When I look at fat quality, I do focus on, of course, we know as it relates to fatty fish, trying to get people to consume that, at least twice a week. It's a challenge because people aren't fond of it. So then I'll move into flax seeds, flaxseed oil, walnuts, things along that line. But then, of course, we can't ignore the importance of vegetable fats from the oils, the margarines made from those oils, nuts, seeds, as a part of eating plans, not just as a snack here or there. So really teaching people.
In much of the Western world, it means switching from butter to margarines, to cook not with butter, but cook with vegetable oils, and choose products that are made with vegetable oils, where the saturated content is minimum and where the saturated fat has been replaced by unsaturated.
This international meeting is the beginning of a global movement to help consumers improve their diet by choosing the right type of fat. The experts were committed to go back to their countries to disseminate the outcomes and to locally implement the call to action. Country by country, consumers will be provided with practical, motivational and actionable ways to make healthier choices in their fat intake.
The most important outcome of this meeting, first of all, is this document, which is supported by evidence but gives very clear, easy to understand recommendations. And the other thing is that we had extremely good experts from different parts of the world here. And so what we say is that this meeting is not the end. This should be the beginning of a very important global public health action, that based on this document, we should have activities, meetings and others in different parts of the world, really communicating the message, and not just communicating, but promoting different actions along these lines.
Well, this meeting brings together a lot of very knowledgeable people from all over the world, people who oftentimes in their scientific association have leadership roles. So we hope that these people will spread the message in their environments, in their communities, in their scientific societies. And then it is hoped, of course, that a lot of these messages are also transferred to the media and thereby will spread to the general public. We hope that also regulatory authorities and governments will hear the message and will contribute with their means to getting the message across, getting the message to people, and support people in choosing healthy lifestyles.
This is the start of a journey, and we hope today to get clear statements about what is important, fats and health. But it's, as I said, the first step towards more things. After that, we will follow up with events, local events, where we try to disseminate those messages further. And in the end, we hope to have quite a group of people who are champions for this cause, who are armed with real good statements, clarity, and that way we think we can start changing people's mind, people's actions, people's behavior. And we all know that small changes in diet can make quite an impact in public health.
Reaching out to the public is going to require all of us as healthcare providers to really collaborate. We can't isolate. as a dietitian, I can't just worry about my patients. I need to work with my patient as they interact in their communities, in their schools, as food providers, whether it's the industry, the restaurant, the school food service. It's all of us together.